Hello everyone. Today we'll be presenting on measles, or also known as rubella. Rubella is the scientific name for measles, but it's the same illness. But my name is Erin Foster.
I'm Amelia Lamb.
I'm Halle Purles.
So measles is an infectious disease which is caused by a virus, and it can be appeared, as you saw on the first slide. It's a blotchy red rash, and it starts on the head and it slowly moves around the body. And it can spread from person to person very easily, and the impact that it can cause brain damage and respiratory issues as well. On the next slide, we'll go further in depth on that. But it's prevalent for us because when we're babies, we get a vaccine, the MMR vaccine, that prevents against measles, mumps, and rubella. So because of that vaccine, there has been no reported cases in Utah in 2024. In the United States, there's been 264 cases, and then international, there has been an average of about 300,000 reports per year. And so it's been able to go down a lot because of that vaccine, which is why it's so important that we are vaccinated and that we keep up with those.
Okay, for the nursing assessment, the most common symptoms are blotchy rash that we mentioned starts on the head and moves down on the body. And then there's also a fever, cough, runny nose, conjunctivitis, which is pink eye, feeling achy, and then tiny white spots inside the mouth. And most often these symptoms occur 7 to 14 days after contact with virus. So, like we mentioned before, this virus spreads when the infected person breathes, coughs, or sneezes. This can cause severe health complications, especially in children under the age of 5. The common complications are ear infection and diarrhea, but the more serious complications are pneumonia and encephalitis, which is swelling of the brain. There's no treatment for measles, but the vaccine is the best way to prevent it. Herd immunity requires 94% of the population to be vaccinated. The tools used to assess is screening the patient, urine tests, either nasopharyngeal or throat swab, and then possibly a blood test. Interdisciplinary team approach would just be that healthcare workers are vaccinated and that they use the proper PPE when caring for these patients. And then the impact on daily life is the rash may last about 7 days, but most people fully recover within 2 weeks.
And nurses, they can have an important role with managing patients with the measles illness. And so one thing that nurses do is they assess the patient for the symptoms, and they also check the hygiene practices to be able to prevent the spread of the virus further. The nurse will plan to keep the skin clean, dry, and intact, and the patient will understand the purpose of the isolation. And the nurse will also educate the family and the patient on the MMR vaccine to prevent it further. For implementation, the nurse will isolate the patient according to the protocol/orders of the facility that they're in, and they will ensure that the proper PPE is worn at all times. Also, prevent any type of scratching on the skin, and make sure that the skin is moist and that they follow the provider's recommendations. The nurse will evaluate the patient's mental status with being isolated and evaluate if the healthcare plan is effective. They'll coordinate with the provider and ensure that all the healthcare team is on the same page, including the aides, and ensure that the aides are aware of what to look for and what to report to the nurse. The nurse will always advocate for the patient and will protect privacy and will make sure that the patient feels safe, heard, and cared for, especially while they're in isolation. And then documentation, they will document specifics of individual behavior, the plan of care, and responses to the intervention/teaching. And then the nurse will always ensure that's accurate and detailed. And then safety, number 1 is the isolation and ensuring that PPE is worn at all times.
For measles, it is really important that patients are educated because it is so infectious. So for general patient education, it's important to know that anyone out without the vaccine is at risk for measles. And it's important to educate patients on the symptoms they might experience and any complications. Preventative measures that you can teach patients about are like wearing a mask and understanding infection protocol and why they may be isolated in a room with limited contact, and also to just educate them on the use of PPE and equipment that slows the spread of disease. So triggers avoidance, just anything the patient can avoid, is processed foods, caffeine and alcohol, and contact with others. And then for action plan and recovery, kind of what the patient can do for themselves is to drink enough water, stay home, wear a mask, eat healthy, rest, take supplements, and just to kind of wait on doctor's approval and what their doctor says. And patients can also take ibuprofen or acetaminophen to help with their fever. And yeah, measles has no cure besides the vaccine. Okay, just to conclude, measles is a very serious disease that can be prevented by the vaccine. And yeah, so it's a good thing we have the vaccine because of it, measles has nearly been eliminated from the United States. There's only about 200 cases this year, but it still does affect many countries across the world. So it's important to know about it and what we can do about it. And if you want to read more information about measles or the vaccine, you can visit the CDC website to learn a little bit more. But thank you guys.
And then here's our references. Thanks, guys. Have a good day.